Good afternoon, dear chairman, dear audience. Let me introduce my PhD projects. I'm Koppány Kocsis. I'm working as a specialist in Uzsoki Hospital, the orthopedic department, orthopedic traumatology department. I would like to give a better attendance with faster and more accurate diagnosis to our patient with my team. To gain this aim, my research will be the comparison of the accuracy of ultrasound and MRI assessing the injured anterior talofibular ligament and the medial collateral ligament of the knee. My first topic is comparing the diagnostic accuracy of ultrasound and MRI assessing anterior talofibular ligament injury, which is the most common injured ligament of the knee, the ankle. The typical mechanism of the injury is an inversion trauma. For example, somebody steps into a hole or a rock and it makes supination stress. We didn't have evidence that a clinical test can evaluate the level of the injury. However, the treatment depends on it. When we would like to know surely how serious the tear is, we use MRI nowadays. Ultrasound could be a good alternative because it can be performed during the first patient visit immediately. It's fast, widely available, and it's a relatively inexpensive diagnostic tool. Our clinical question: is ultrasound good enough to quantify the level of the injury? We checked the acute ankle injured adult patient and compared the sensitivity and specificity results of ultrasound and MRI findings. I found just several articles in these topics which shows us we can research more in this field. As I finished the selection, I found 10 eligible articles and examined the specificity and sensitivity of the ultrasound compared to the MRI. The sensitivity shows the possibility of finding an injured patient. In the 9 articles, we could examine 367 injured patients and found 352 positive cases with ultrasound. It's 97%, which is very high sensitivity in a diagnostic method. The population was homogeneous. The specificity shows the likelihood of finding a healthy patient. In the 9 articles, we could examine 152 healthy patients and found 141 negative cases with ultrasound. It's 93%, which is high specificity. This is a common form of visualization of a diagnostic tool efficacy. On the vertical pivot is the sensitivity, on the horizontal pivot is the 1- specificity, as known as false positive rate. As the diagnostic method became better, the summary estimate takes place closer to the upper left corner. It signs the blue square. The calcaneofibular ligament injury was found in 7 articles beside the ATFL tear. It has a close location to the ATFL and the mechanism of the injury almost the same. Less frequently injured than the ATFL. From 178 injured patient, 143 was recognized as a positive case with ultrasound, which means 86%. The specificity of examination was a little bit better. Here it's 96%. This is the two-dimensional regression of our data about calcaneofibular ligament, and the summary estimate shows that the sensitivity and specificity is high as well. The strength of our study is the appropriately selected patient population and circumstantially documented cases. It will be the first meta investigating only acute adult cases. Our limitation, we didn't fund randomized control trials, and we found only 9 articles. In conclusion, we can say ultrasound has good specificity and sensitivity concerning ATFL and CFL, therefore may be a good alternative of MRI examination in the diagnostic of lateral ankle injury. Based on our data, it could be primary diagnostic method in acute cases. An appropriate classification system and practice is required for examination. Implication from practice: ultrasound is easy to use to follow up the cases, but training is necessary for ultrasonography performers. We can select those cases where MRI is offered, and we can make new guidelines for treatment. We can offer for scientists developing more sophisticated grading system to treat specialized treatment. Yeah. My second and third project has the same title, comparing the diagnostic accuracy of ultrasound and MRI, assessing a medial collateral injury of the knee. I will make a systematic review and meta-analysis in topic. This is the most common injured ligament during knee traumas. We haven't evidence suggests that clinical tests can grade the level of the injury. Sorry. MRI is the gold standard to diagnose ligament injury, but we would like to improve the role of ultrasonography. The clinical implication is it could be, the ultrasonography could be a good alternative for grading. We will check the sensitivity and specificity. After a systematic search, we are investigating on feasibility of network meta-analysis. My last project will be a cohort study to compare the diagnostic accuracy of ultrasound and MRI, assessing in medial collateral injury, the same background as I mentioned. As MRI is the gold standard, and we would like to know ultrasound is good enough to quantify the grade of injury. We will involve those musculoskeletal remachured patient who has acute medial collateral injury without meniscal or cruciate ligament injury. We would exclude children and multiligamentar injury patients. As a first patient visit on the ambulance ward, I would like to make an ultrasonography examination after a physical examination, and after that I will send this patient to MRI and compare the sensitivity and specificity results. And on the second part of my PhD research, I would like to take part of daily routine, this examination, and more practical, finally way. Thank you for your attention.
Congratulations for these nice results. I would like to ask that all of your projects are about ultrasound examinations. My question is that do you need a special kind of ultrasound machine for this, or is And is it, if no, then is like a general everyday used in the daily routine ultrasound machine is enough, not the most expensive for this kind of making this kind of diagnosis.
Thank you for your question. The ultrasound machine is enough general. Sorry. The machine is equal. The head of the examination head, we would like to use a linear head with high megahertz interval. All the articles used between 7 and 12 or 13 megahertz interval heads, linear heads. It's good for identify the superficial layer.
Congratulations for your presentation. So my question is, as far as I understood, MRI is the gold standard. So your aim is to replace MRI by ultrasound, or you just want to advise performing ultrasound before MRI?
We didn't want to replace it. MRI is hard to access. We need to wait for long weeks to take an MRI in the main most of cases. We would like to not to replace, to bring in a new device which is much faster, and we thought that we can use ultrasound to give a better attendance with a faster diagnosis. We would like to make a new grading system and a new guideline for treatment to decrease the immobilization of the extremity, the injured extremity.
Yeah, thank you.
Having been seen all this sensitivity and specificity of this diagnostic tool, how to make the diagnosis, how to make the indication for surgery, having been seen all this specificity and sensitivity. You are an orthopedic surgeon, you have an injured ankle. How to make the surgical indication, having been seen all this diagnostic tool?
If you, if a patient has just ligamentary injury without bone fracture on common X-ray, at first we offer to take conservative treatment.
Which one is the most helpful in this diagnostic tool, within this diagnostic tool? The most useful one for surgical indication?
For surgical indication, is the most useful is MRI, because it shows the bone system as well and the soft tissues as well, and we can check the cartilage as well, the cartilage injury. But in the most cases, we use conservative treatment at first, and when somebody didn't heal, has resting pain, then we can make the MRI, and we can depend on surgical treatment.
But the most useful one is the clinical investigation. Okay, the clinical investigation, number one. And all the rest is the second, third, fourth. Okay?
Just one comment. Just one comment. We work together with Koppány, so the main aim of this study is there are silent, not really injuries in grade 0 and grade 1 in ultrasound cases. So there is no ligament here, just a hematoma inside the joint. So in these cases, we can exclude it from the normal aftercare, and we can give the patient a faster recovery, faster rehabilitation, a shorter time of brace wearing, and so on and so on. So the main aim would be this at the end.
Okay.